Your health is the most important thing you can invest in. Good morning, guys. This is Dr. Brenden Cochran. Hope you had a fantastic long weekend. We are going to talk about some proactive tips for your health and give you some updates on what is going on. So, what do we got going on today? Well, everybody got out. You probably saw lots of pictures. There were certain areas of the country wasn't social distancing. We're going to really learn. We'll probably see what happens the next 3 weeks by Father's Day if things are settling down as we're being told, or if things ramp up. There's obviously a lot of concern with this, as this is an experiment, as our death rates are continuing to climb. We're expected to pass 100,000 very quickly, and if we continue on this trend towards the end of the year, you can see that rate may be significantly higher, possibly even 200 to 300,000 if we continue on that rate, or we get another bloom. Again, I'll remind you, most of what we've seen is it is attacking people, especially more deadly in a person with pre-existing conditions. This is why your health is absolutely critical, as you can't continue to live in a bubble, and you will have to get out as we're seeing things are lifted. Lockdowns are there's this parameter that we have on locking down, and really it could have been done better. I totally agree with you. There's certain areas, rural areas, that probably didn't need to be locked down as hard, and it affected them economically. And if we would have good testing and good tracing of people, then we'd have a better idea of, hey, there's a little cluster going here, boom, shut that down, put some extra measures, and then allow these other places to function. So the problem with lockdowns for long periods of time, as we're seeing, is then they start to be worse than the actual illness themselves. And you have people losing their jobs, you have people that are in a very depressed state, and that's not helpful for your immune system as well. And you're not able to socialize with those family members. And we know in several papers, not just around COVID, but social interaction is a huge risk factor for mortality over a person's life. So there's a balancing system that we have to do. And I do believe the way we get to that is everybody does really good hygiene, and we wear masks when we're in large, dense, populated areas or indoors, like grocery stores, hardware stores, etc., like that. That has to be done, and then we can move forward. So is this going to go away over the summer because, like, the colds or flus do? Well, remember, the colds and flus usually go away because few things. One is we don't have the heaters running, and that doesn't dry out our mucous membranes like stoves and heaters during the winter and fall times. And when we dry out our mucous membranes, it makes us more susceptible to getting illness. The other thing is we typically are more indoors amongst each other versus out in the fresh air, where it's very diluted out and there's not a concentration of virus or bacteria or fungus floating around. So your air quality and cleanliness of the air is absolutely critical. So are we going to see this thing drop? Well, it's very possible it levels out. I definitely agree with that. It could level out during the summer, and then possibly come back as we go back into that style of being in with the heaters and the stoves and everything else going on. It's very possible that could happen. The other possibility is that it may not slow down despite the warm weather. Because what we're seeing, if that was the case, you would expect Brazil, with fairly warm temperatures and high humidity, that you shouldn't be seeing a big spike like that. Brazil is climbing very, very rapidly with deaths. And you're seeing these mass graves, and you're seeing what's happening if you just have a no mask and keep working approach to that. So they're climbing very, very rapidly. And if you're looking at the tropics and subtropic climate to see, is this going to save us? It's not looking good, at least. There is a study, however, that was published just recently. It's head of print, so it says August 2020, It's ahead of print, but basically it does look at dose relationship of um, if that viral load flattens in transmission capability when you start to get around 25.8 degrees Celsius, which again, 26 degrees Celsius. So we double that number. We're sitting around what, 52 there plus 30, so 82 degrees Fahrenheit roughly. Um, that we see that it starts to kind of plateau a little bit, but it's still going on. It's still being spread. And then what we notice is if we add 1 degree to that, it could be associated with a decreased cumulative number the hotter and hotter and hotter and hotter we get, possibly. And I think part of that may be because what we know about this is when it's exposed outdoors, we have the UV lights destroying this fairly quickly when it's outdoors, and it also gets diluted out. The thing is people usually when it gets warm are indoors. If it's too warm and too humid, they're indoors with AC, and the AC is just circulating the bug around. So I think what makes this difficult, makes this challenging, is most countries that you're looking at that have warm temperatures and high humidity, usually they're indoors quite a bit because they're trying to seek out from the high humidity and the heat issues. So what I'd like to see happen is maybe going to more rural areas or areas that don't have AC or don't have everybody packed inside and are used to living that climate, and just see what's going on there. We may not have data because, again, less people, less spread. But just something interesting I'd bring up. Another thing that came out from Singapore, which is promising, is that this COVID-19 no longer is infectious after 11 days. So therefore, that 14-day parameter that we've said, once you're sick, after being sick, 14 days, you need to self-quarantine, and then you can go back to work. And previously, we thought this was much longer, 21, 24 days, or maybe 30 days, where a person could be infectious. So this is good news that we're finding out, hey, even though these people test positive with PCR, they don't seem to be infectious past that 11-day window. Now, the thing we need to look at further, I think, is there are the different strains I talked about in the past. Remember, there is the one that was running around in China and then most Asia that was very mellow, that we got mostly in like Washington and California, where it was the mellower one, versus the European strain, which was much more rampant, more contagious. Um, we don't know if this guideline of 11 days pertains to that other European strain, or is this mainly just the one that came out of Asia? So that would be my caution of why we need more papers looking at how long these infectious agents are in the two different strains. So I'd like to see something out of Europe or the East or parts of the US confirming this finding, and seeing what happens before I get too comfortable with, hey, 11 days, you're good to go, right? Remember my patient that I was telling you about, one of those patients who we tested positive for 47 days with PCR, and then they cleared their antibodies where they had some immunity to that within a 30 to 47-day window. Somewhere in there is when they did that. Well, we retested that person just last week with the nasal because we know the antibodies were all IgGs, and IgGs mean, hey, you have some immunity to this, right? They cleared their IgA. They never had any IgMs, at least when I was testing them. So that means they probably had it even earlier when they were asymptomatic. So we did the PCR. This was on day 61. Well, why not 60? Well, it just happened to land on the day when the patient could come in, with the weekends and everything else. So day 61, repeat nasal PCR test, and it was finally negative. So that means the viral particles finally cleared out of the person within that, after that 47-day window. I don't know exactly when that was since I wasn't doing every single day, but somewhere between 47 and 60 days, total viral particles were cleared out. Remember when I reported last time at 47 days, that specific patient had a positive PCR, which is the nasal scrambler. You put up your nose and you get a result. And their antibodies were normal, which indicated that they seroconverted, meaning they built antibodies to it, and it did not look like they were contagious anymore. They had no IgA at all. So that was good. But they still had the PCR, and my suspicion was the PCR is still picking up dead viral particles, because some of the reports we were seeing out of South Korea about people testing positive but not being getting symptoms or being as contagious. So we will see on that one, but I would be cautious on the 11 days yet until we get somebody else to confirm that for you. What other treatments are going around? So there is actually that was just put in. The recruiting for it is using a combination of medications with ivermectin, which we use for parasites, azithromycin, which most of you have heard about, the hydroxychloroquine and azithromycin combo, and cholecalciferol, which is vitamin D. So, and we talked about vitamin D levels and being critical in reducing mortality rates. So your vitamin D levels, when they were between that 50, 80 range, you were protective, versus if you had a low vitamin D level below 30, you had a much higher risk of mortality from this. And that goes for most actual upper respiratory, like influenza as well. Mortality rate goes up when your vitamin D goes down. So if you haven't got that checked yet, make sure to get that checked. Don't just say, hey, I go out in the sun a lot, or I take a product over the counter and it's total crap. Make sure to work with somebody to get that checked so you know where you are, because that is absolutely critical in your proactive strategy. Now, this is very interesting because we at the clinic use ivermectin. We use azithro occasionally for respiratory, but ivermectin we use more commonly for some people with some parasitic-like infections or Lyme's or other conditions. And it's very well tolerated for people. So it'll be very interesting on this specific clinical trial to see what they come out with, because there are other small case studies and small trials looking at ivermectin a couple months ago, and they said it was promising as well. So it'd be very, very interesting to see what comes of that. Now, the big one today that I want to talk about is an anti-malarial. It's actually a medication derived from an herb. Artemesinin, or wormwood, is the common name. Now, where have you heard wormwood before, right? Most people are probably familiar with wormwood because they think, oh, it comes from absinthe, the alcohol absinthe, and doesn't that make you hallucinate and cause damage to your liver? And the answer is no. That was old folk tale that it was the wormwood that was doing that. And in fact, there was another chemical that was in the alcohol at the time that was causing the person to hallucinate. It was like an ether solution that was very toxic that is no longer in those products. So to disprove, wormwood doesn't make you hallucinate. So please don't get that out of your mind. The alcohol in the absinthe may cause you to be a little rummy, just like drinking any other alcohol, however. So artemisinin is really truly dear to my heart, because part of my fellowship and research was in artemisinin and vitamin C therapy with integrative cancer treatments. And we were one of the forefronts to use this IV with vitamin C for cancer patients. And this new article that was just published May 13th, 2020, again, it is ahead of press, so it's a preprint, is fascinatingly awesome because it does a very comprehensive explanation of what artemisinin does, or what artesunate does, in the expression of different chemical molecules, and something called the reactive oxygen species that we've talked about in some of our other videos. And it goes over the different forms that are available. And I would say there's an awesome picture on here, actually, that it gives you a figure, and it shows you specifically, because the article does look at and say, hey, artemisinin could be a potential agent used in your whole strategy for treating a person with COVID-19, because we use it in other respiratory illnesses. I mean, artemisinin got its claim to fame right now because it's the anti-malarial when you have resistance to chloroquine or quinine, that we use this, and it's actually approved by the FDA for anti-malarial use. Now, the funny thing is we used to use it as an IV product, and get it compounded because it's a drug everywhere else in the world, and it's used for malaria. In this country, however, several years ago, they basically said, well, you can't have that, compounded as readily anymore because they're trying to make it into a drug, yet it hasn't made it up onto market yet. So that's one of the scenarios that we have right now. But you can take it orally also. It can be infused still. And there's other rectal administrations as well, suppository forms that can be administered as well. But I really like this diagram because it goes over almost all the mechanisms of action for different types of cancers. Even allergic rhinitis, stuffy allergies, how it works to help reduce allergy symptoms. It goes over explanations of how it can fight different viruses like cytomegalovirus, how it can be used in asthma and COPD, how it can be used in pulmonary fibrosis, which is a scarring of the lung tissue, and then a ton of research using it in lung cancer. And then more research on acute lung injury. And I think that's the one where they said it could potentially be a supportive in COVID-19, because we know the lungs take a big injury for this. So any lung injury, it could be effective in that. And that's why they said any upper respiratory infection, it definitely could be part of that. So in our clinical practice, we use our artemisinin, the herb form, a lot. I mean, across the board, a lot in patients, for immune health, for cancer support therapies. And we also know how to use it as an IV deliverable as well. So that was very awesome that we have another paper on artemisinin and respiratory illness as well. So take a look at that paper if you haven't yet. It's amazing. I really like how they summarized everything. All right, guys. So with that said, we're going to reduce the videos down a little bit because, hey, this has been a great run, but it does take a lot of time, and I appreciate all you guys for tuning in, but I have other projects I also have to tend to. So we're going to reduce the frequencies of these videos down to 1 or 2 times a week. Definitely going to try to keep the Monday one going, at least the Monday one. So you'll have a ongoing Monday unless it's a holiday. The other thing is that we have going on now is we have newsletters, and they go out about twice a month, and they'll be dropped on Fridays. So if you want to be part of that newsletter for proactive health tips, and you're not on our email list, then you can email in the clinic at info@interactivehealthclinic.com, and we can add you to that email list. If you are currently a patient of ours, then you're already on that email list as well. So if you want to continue to get those, please do sign up for that. Again, otherwise we'll transition our videos at least once a week, possibly twice a week, for the time being. All right. You guys have a great day, and click the like button, hit the share to other people, and we will talk to you later. This is another really good incentive to invest in your health. Investing in your health is the best thing you could ever invest in.